Okay, everyone, we're going to start. Let's take this off. Hi there, my name is Meg Krudish. I'm the Director of Admissions. Welcome to CUNY School of Public Health. We have a packed agenda, and so I would first like to welcome Dr. Ashish Joshi.
Good evening, everyone. Good evening, yeah. Sounds good. First of all, my name is Ashish Joshi, and I'm a Senior Associate Dean for Academic and Student Affairs. You can feel the pulse of my excitement. We are thrilled to have you all. Especially, I would like to thank Senior Associate Dean and Chief Academic Dean Joseph from the Macaulay Honors College. And I know we will have the privilege to be joined among ourselves, Dean Mary Pearl. She might be coming at any moment. More importantly, I would also like to thank all our esteemed faculty who are representing across various departments from the public health. Associate Dean Lynn Roberts, who is for Student and Alumni Affairs, and I also would acknowledge and thank Macaulay Honors College staff who has been very diligently working to make this happen. Very importantly, this is a great moment because this is a first of its kind initiative we are starting. So we are very excited to have this 4+1. And this won't happen if the students who are excited and thrilled to be among us out over here today. So as I just mentioned, we are thrilled to have Dean Mary Pearl among us. And
Did you say that before I arrived?
we just said, so I think even the rain gods are listening to it. So I think I would take this privilege on behalf of the Dean, as well as the CUNY Graduate School of Public Health and Health Policy, to welcome you all to this very exciting, innovative, and I would say we are very passionate about this moving forward. I remember my conversation with Dean Mary Pearl on some other context for last several years, and I think today we are very excited that this is something which is reality, and this would not have happened if we would not have Senior Associate Dean and Chief Academic Dean Joseph pushing this with that compassion the way we are trying to go forward. Very quickly, just to give you a brief, that I'm a clinician by training. I know a lot of Macaulay honors students like to go to medical school sometimes. So I'm an internal medicine physician, and I did my master's in public health with majors in epidemiology and biostatistics and a PhD in informatics. The reason I gave this kind of a description, that the careers can be unconventional sometimes, and we need to basically look at them as a strength and not just as a weakness. Thirdly, the way we are hoping today is to more like an informational session to just orient about what public health programs which exist at the CUNY School of Public Health, and what are the different opportunities which exist for you all, both in terms of the career options and also some of the very exciting research what the faculty and the various centers and institutes which are doing here at the School of Public Health. I'm not going to take too much time. I know we are running late. I would take this honor and privilege Dean Mary Pearl to please come and welcome.
Thank you. Well, hi. I feel so funny just having to move away from you rather than closer, but I wanted to be here particularly because I value this institutional relationship so much. I also have an unusual background in that I trained as a wildlife biologist, and then I became increasingly concerned as I sort of moved up and ran an organization of wildlife researchers. And I was noticing that they were, I had one who came back who had been working in West Africa with an unknown virus. And being the zoology nerd I was, I thought, oh gosh, I wonder, we're not thinking about health in wildlife. And, I wonder how it's impacting those populations. And I thought this is population biologists in the wildlife field are not looking at disease as a driver of populations. That's how I intellectually sort of engaged. And it was only, I started making links as one has to do. If you study health, you need not to only talk to physicians, but public health scientists and also zoologists, yes, veterinarians. And as we all came together, we all had little parts of the piece because it's one health and it's all around us. And that's when I founded an organization that a consortium really that brought together a number of schools of public health, medical schools, veterinary school, and university with an arts and sciences department. The world has only become more vulnerable to issues of movement of pathogens through populations. I don't think there's a more exciting field to get involved with than public health. And I also think it's a wonderful adjunct degree if you go on to medical school, if you go on to wildlife biology, as was my field, or policy. It seems to me, much like business school is sort of necessary for people who are interested in commerce, no matter what the field. It seems to me that public health is so key and fundamental to the well-being of our population that it's a wonderful option. And one of the reasons I was so excited about creating this pipeline is to save a year, so you can just in one extra year of your life prepare yourself to have a career with much more dimension and possibility. So I just wanted to communicate that, and I also wanted to thank our colleagues at the School of Public Health here at CUNY for being so receptive and open and creative in working through the ways we could provide to you this exciting moment. And I'm so thrilled that you all have the opportunity to be pioneers in this new way of preparing yourself in a career. So I'm not going to take up any more time, but I just did want to have, by my presence here, state how enthusiastic I am about this program.
Thank you very much. Up next is the Senior Associate Dean and Chief Academic Officer, Macaulay.
Hi, good evening, everybody. I have had not a very unusual career, and I am not a scientist, and I'm not an expert in public health or a medical doctor of any kind. I started as an English teacher and was mostly an English teacher all the way. But in the time I've been at Macaulay, there's things I've learned about Macaulay students and about the Macaulay program that I think makes this just such a nice fit for you. It's part of what makes you Macaulay students, makes you perfect students for the CUNY School of Public Health. And as an outsider, someone who's not part of the field of public health, what I see as kind of distinguishing this field is that it takes a broad view and an integrative, interdisciplinary view, so that it's not about treating an individual person, but about preventing illness on a wide range or promoting health in a wide scale and looking at complicated problems in a complicated way, not oversimplifying. So that's something that I feel like your Macaulay education really prepares you for and gets you on the right road to get this kind of degree. I'm going to let the faculty here tell you really what it's all about, but just sort of for the mechanics of the program, how this will work, we'll have a question and answer time, but the overview is you will apply. The application is opening in exactly 45 minutes. And so that you can rush right home and apply. The application will be open until March 2nd at 5 p.m. So you have some time. You don't have to rush right home. The application for this program from our end requires only a basic form, sort of your name, your campus, your EMPL ID, and all those numbers that you like to know and love, and a personal statement that describes why you're interested in this kind of study and what kind of commitment you could bring to this kind of program. Our writing specialist at the Macaulay building, Cam Stewart, would be very happy to help you with that personal statement if you feel like you need the help. We'll also look at your transcript. We may talk to your advisor and your professors, but we're trying to make it kind of a welcoming experience because we want students who are going to have the commitment and the drive to succeed. In terms of what this program would do for you, there's some big advantages and a small disadvantage. And the small disadvantage I'll say first is you're going to have to work hard. It's going to require, you're Macaulay, so they're like, we don't care, you know, you're used to working hard. You're going to be taking graduate courses while you're still an undergraduate. And we know that can be challenging, but we know you're up to the challenge. So that's the only disadvantage I see. The advantage is, as Dean Pearl and Dean Joshi have suggested, you get a jump start on a graduate degree. You get to get some of those credits finished while you're still a Macaulay student, and then you can finish the master's much more quickly. The last thing I'll say, though, is I don't want you to think of it as sort of just a shortcut, because there's ways that taking those graduate courses while you're an undergraduate can also enrich your undergraduate experience. You can learn new perspectives, you can learn new expertise and gain new skills that are going to help you in your junior and senior years at Macaulay and help you bring more to those classes. So it kind of works both ways. Your studies will be, or three ways. Your studies will be enriching you, enriching the School of Public Health, and enriching us at Macaulay, which is one reason why we're so excited about this program. Of course, we'll have time for question and answer, and I want to give time to the faculty to talk about their programs, and I hope you're as excited as we are. Thanks.
Pop quiz. Who knows what public health is? Okay. You might know, you might not, but up next, Dean Roberts is going to give a little bit of overview of what is public health. And Good evening, and I am Lynn Roberts. I'm the Associate Dean of Student Affairs and Alumni Relations here. And I'm going to be very brief because we have this whole panel of experts here who are going to elaborate on what public health is, for sure. So quite simply stated, public health promotes and protects the health of people and the communities where they live, learn, work, and play. Pretty simple enough, right? Well, to elaborate, it's a interdisciplinary field, and these are just some of the majors, areas of study that, lead folks towards public health. And I don't know what any of your majors are, but are there any majors that aren't reflected here? Urban planning, see? So there's so many others, right? So many others, exactly. And public health involves the application of many different disciplines and areas of study. There are 5 core fields of study in public health, and all of these will be elaborated on by my colleagues and are reflected in our various degree programs and beyond, because as was mentioned earlier, we have institutes and centers that also focus research in all of these areas and more. There is no human endeavor that is outside the realm of public health, according to the former director of the CDC, or the Centers for Disease Control and Prevention, who was an American physician and epidemiologist who was credited with contributing to the eradication of smallpox some decades ago. Here is just a brief snapshot of just a few of the milestones in public health across the previous centuries. From the establishment of the Public Health Act in Britain, when the American Medical Association here in the United States established their Public Hygiene Committee. And most folks think of the start of epidemiology, at least, with John Snow breaking that handle on the water pump. The 20th century saw an explosion of public health activity, including the establishment of the first schools of public health and vaccinations that eradicated not only polio, other diseases, motor vehicle safety. All of these things we attribute to public health. More recently, in the 21st century, and I think many, if not most of you, were born in this century, is that correct? I have a 22-year-old son who's graduating in May, so I think you're around his age. So these things that have been happening in the 21st century, and these are just a few up to the present day, but I just wanted to highlight that some of the gains that have happened in previous centuries, some of those are taking a bit of a slip back, right? So we're seeing some reemergences of public health issues that we thought had already been resolved that are creeping back because of challenges that we're facing, rising disparities and inequities in health and disease. So even when there are evidence-based public health interventions and solutions available, not everyone has equal access to them, and that's a problem. We're seeing an increase in nutrition-related chronic diseases, such as diabetes, climate change and its impact on the environment, and human health, of course, the migration and displacement of people because of war and violent conflicts. We have an increasing aging population. This year alone, we're going to see more people over 60 than under age 5. And that has implications for how we're able to service them, but also who can support them, right, going forward, if they aren't also properly prepared and trained. And then the dismantling of gains in the social safety net that made those gains from the previous century even possible. And this is just a few of our challenges. So in response to this, the public health workforce is vast. Public health professionals work in a variety of careers to prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. And this is often in contrast to clinical professionals like doctors and nurses who focus primarily on treating individuals after they become sick or injured. Public health also works to limit health disparities. And a large part of public health is promoting health equity, improving the quality of care, and increasing accessibility to resources. So, to wrap it up, whatever your career aspirations are, we believe there is a place for you here in the CUNY Graduate School of Public Health and health policy, actually in the public health workforce, and the pathway to that is here at the CUNY Graduate School of Public Health Policy in collaboration with our colleagues at Macaulay Honors College. So welcome this evening. I hope to welcome you again soon to our program. Thank you, Dean Roberts. I will give just a very brief overview of our school and the structure here. There are 4 departments within the School of Public Health here: Health Policy and Management, Environmental and Occupational, Geospatial Health Sciences, Community Health and Social Sciences, and Epidemiology and Biostatistics. We have 3 doctoral programs, 5 MPH specializations, 4 MS specializations, and 3 advanced certificates. We're a graduate school only. We do not have any undergraduate programs. A lot of great graduate work happening here. So these are the different programs that we do offer. You'll see the 5 MPH concentrations and the MS ones. Just kind of a show of hands, how many of you are interested in the MPH concentrations? Great, most of you, and I know some of you are already in the MS. I met some of you as well. Okay, that's great. The three of the MS programs are entirely online, so that's a really great thing that you can do from anywhere in the world, wherever you are. And we just want to mention that we do have these certificate programs as well, right? So tell your friends, tell your cousins, tell everyone. We are an accredited school, and we're very flexible in our schedule, just in our offerings and our courses, just like most CUNY schools really are, right? So all of our courses are offered in the evenings, anywhere from 4 to 10 p.m., Monday through Thursday, no Friday classes, no weekend classes, and online, so evenings or online. A lot of our students work part-time or full-time, so this gives them a really great flexibility to finish their degrees while working, while taking care of families, while doing other things at once. Okay, so this is also available to you as a student, having that flexibility. 15 out of the 42 MPH credits, I saw that most of you are interested in the MPH programs, can be done entirely online or in person. Some people love online courses, some people love being in the classroom in front of all of our great faculty members here, and so it's up to you, very flexible. Just a very brief rundown of the curriculum. It kind of will vary depending on which specific MPH or MS program you'll be doing, or you'll choose to do, and that's in those handouts right there. Take whichever ones you want. They're also on our website. They're also on Macaulay's website. Just kind of gives you an overview of what courses you'll be taking Macaulay, not what courses, but when, and then what courses you will be taking here at the School of Public Health, right? But it's pretty obvious that the first 3 years, you're at Macaulay, and then that one last year, when you're senior year, you're doing a lot of undergrad, you're doing a lot of graduate work, and then the summer and the last year is here for the most part. Our programs range anywhere from 33 credits to 42 credits, so it will obviously depend on which program you choose and how long it takes you to finish your master's degree. Okay. I want to make sure that you're aware that we have a number of centers and institutes, and our faculty will tell you a little bit more about them, where great research is happening. And I'll show you where that is on our website if you want to look at it and kind of read a little bit more in detail. Joseph already went over the application process, but I just want to make sure that it's here as well. It's on our website, it's on a new website, at the Macaulay website, but there's kind of a two processes, right? The first time you'll be doing that internal application, you'll be taking courses on e-permit, and then the second is being provisionally admitted to the School of Public Health and then finishing your MPH or your MS that way. I'm the Director of Admissions. So if you have any questions at all, let me know. You should have received an email from me already today, right? Definitely contact me, email, phone, however you would like. And that concludes my little presentation. Do you have any questions right now that I can answer for you? Yeah. So if, can you, I think I understand your question, but I just want to make sure that I do. Can you repeat it? So your undergraduate curriculum, right, is up until here, right? And so you'll be taking all of your courses at Macaulay, and then you're taking 2 online courses or in person. Are you a junior right now? Right. So this summer, you'd be taking 2 of our courses, either in person or online. So that's 6 credits. It's up to you what you do. They're offered both in person and online. Right.
So, because you're undergrad? No. 15 of our courses are
Available. Oh, I'm sorry. Yeah, I misunderstood your question. Yeah.
5 core courses are offered online. But you can take that same course
In person if you want. Yeah. I'm sorry, I misunderstood. Thank you. But that's a great question. Anyone else have a question?
Yeah.
Yeah. Here.
So you can up to 15 credits is max what you can I think that answers your second point what you said. Don't think you can finish the whole math while you're still an undergrad.
So only 15 have an undergrad degree on the mic.
Right. So you can take only 15 credits while you are an undergraduate student. And therefore, those 15 credits will count toward your undergraduate degree and your graduate degree at the same time. Correct. We have a great advising team. We have as a student at School of Public Health, you have 2 advisors. You have an administrative advisor and a faculty advisor. And one of our administrative advisors is here right now, Matt Pachkowski. And so he is really, really versed in the curriculum for all of the different programs, the 5 MPH programs, the 4 MS programs, all the certificates. He knows all of the courses inside and out. So if you have any questions after all these presentations, definitely go up and ask him any questions. Okay. Okay, great. So we will start with our Department of Epidemiology and Biostatistics, Dr. Nash.
Thank you, Meg, and welcome from the epidemiology corner of the room. When I did my undergrad degree, which was in physics, there was no public health school in the state. And so I really did want to go to public health school, but it required a lot of thinking and logistics to make it happen. So the fact that there's one right here in the city that you can begin to explore with, I think is a really great opportunity. While I was in undergrad, though, I did get a chance to get exposed to epidemiology, which is how I got interested in it. And what I really liked about it was I loved my field of physics, but I also was very interested in a lot of other things. I was very interested in knowing, like, what could I do, what field could I work in that was going to make a contribution to science, to the world. And what I really liked was the possibility that you could collaborate across really multiple disciplines. You could work with healthcare providers, you could work with doctors, you could work with engineers, this is how, and other kinds of scientists, and this is how you got the work done. All the while you're learning about multiple fields. It's fascinated me. And I really began to appreciate the potential for impact on a large scale. And I think this is why you may see, like, some physicians choose to move into the field of public health, because their work as a physician is one patient at a time, and as Dean Roberts pointed out, they're usually dealing with people once they become ill, and the potential for impact in public health is on a larger scale. And I'm very just happy to say that my career has brought me across all of the world. Public health is, of course, an issue for New York and the U.S. it's an even bigger issue when you leave our borders and go to other countries in resource-limited settings around the world, as some of you may know firsthand. So let me get into my scripted part of my presentation here. The Department of Epidemiology offers 3 types of degrees. We offer a PhD in epidemiology when you're ready. Before that, you can work on the Masters of Public Health in Epidemiology and Biostatistics. And we also have a Masters of Science in Population Health Informatics, which is 100% online. And Dean Joshi is going to say a little bit about that in a bit. The mission of our department, if you look on the website, this is our mission. It's to provide students with an understanding of the principles and methods used in the design and implementation of epidemiologic studies, and application of appropriate statistical methods to address real-world public health problems and improve population health. So that's a lot, and it might not make full sense to you right now. And so the way I like to think of epidemiology is epidemiology is really about trying to understand the causes of disease, the causes of health. And when we understand what those causes are, we begin to understand how we can influence them so that we can protect health, so we can promote health, so that we can prevent disease. So it's about understanding causes and influencing those causes and ways to influence those causes to promote health and well-being. And we work with colleagues. So epidemiology is often focused on identifying those causes. We might be focused on helping to understand what the relative burden of disease is and what the health priorities are. And then we work with colleagues in other disciplines in public health and outside of public health to actually, affect change and influence health outcomes on the population level. So that's the way I think about it. And so, for example, the coronavirus outbreak that's happening right now around the world, it is, epidemiologists are focused on identifying the cause. Okay, you might say the cause is a virus. It's very well described. We know its genome, but epidemiology is concerned with trying to understand how that virus is transmitted. And so there was question as to whether or not it was person-to-person transmission early on. Now we know we're focusing on what works to reduce the potential for person-to-person transmission of the virus. Hopefully one day there'll be a vaccine. And then there's a whole host of other things that public health will need to do. It's not enough to have the vaccine. You have to get it to everyone who needs it. A host of other challenges, but very important and gratifying work. So that's what epidemiology is all about. Our coursework, our curriculum is about preparing you to do that. A lot of epidemiology is about understanding how to design scientific studies to begin to understand causes, or to begin to understand whether some of our strategies to protect or improve health are working or not. And so focus on study design, focus on statistics and how to analyze data, big data sets. There's a real quantitative side to what we do in epidemiology, and that's something you should know. So if you like data, you'll probably love epidemiology, although there's room for liking data in many of our other disciplines too. We've thought through our course sequences about how you would move through the program. I think this is going to, obviously it's a little bit accelerated for the Macaulay students. These potential course sequence recommendations are on the website, so I won't spend too much time on them here. I want to turn it over to Dean Joshi for a second to say a little bit about this MS in Population Health Informatics, which is his baby. So Dean Joshi, please.
I think very briefly, I'm very excited about the field of population health informatics. And I think as so clearly you explained about what epidemiology is, I'll put it out what informatics is in a very easy way, okay? So if I say the number 35, what is that? Nothing, right? In informatics, we call that as data. So if we call 35 degrees Fahrenheit, what you're doing is, it's a temperature. So you're giving meaning to the data. That's information. So if you say that if temperature is going to be less than 35 degrees Fahrenheit, there's likely going to be a snow. I'm just making up anything. That's kind of a knowledge. So the fundamentals of informatics is how do you give meaningful data? That is the key. When you are gathering all this data, you are going on YouTube, Google. How many of you are using Google as a health information, seeking health information on the internet? Almost everybody. What is one challenge? I'm trying to make it a very easy way, in a very contextual way. You'll be surprised that according to the Pew Research Center, more than 65% of the US adult population is searching information over the internet to make their health-informed decision making. And one of the biggest challenge is information overload. How do you know which one is accurate or not? So I call this term as information therapy, right? So how do you evaluate the quality of health information over the internet? So I'm just giving you some contextual examples. And the reason I put this is I come from a background of physician. A lot of people say, do I have to be a programmer to become an informatics? No. You have to just use technology as an enabler. A lot of time people are using apps. And you'll be surprised to know that many of these apps may not have any contextual relevance. So informatics is predominantly talking about how do we use technology as an enabler to improve population health outcomes. Okay, very quickly. Several career opportunities according to the US Bureau of Labor Statistics. It's the fastest growing discipline in terms of employment. The average salary in the city of New York is about $110,000 as a graduate. But these are the different, this is the first program globally which is currently being offered. There are several programs which are health informatics, clinical informatics. You'll be hearing about them a lot. These are very hospital-centric and hospital-focused, which is more like patient-centric. This is very preventive and population-based focus. Okay. And lastly, our employers range from academia to industries to startups to research organizations, pharmaceutical companies, and obviously I would say that many of you who might come, we are the first recipient. We would like to have our people, own students, because there's such a tremendous need in terms of this area, right? I'll let Professor Nash talk about the faculty within the Department of Epidemiology and Medicine. Thank you very much. Thank you.
Okay, so just to finish the EPI presentation here, we have 13 faculty that are active in the Department of Epidemiology here at the School of Public Health, and they're working in various areas. I think, this is supposed to highlight for an example of one of the institutes. I run the CUNY Institute for Implementation Science and Population Health, and we have in that institute many students who are directly engaged in working on faculty research projects. And I think that's why this slide is here, just to let you know that there are not only opportunities for training and coursework, but opportunities to work on real-world research projects. Dr. Burrell, our department chair, who will be here a little bit later, is a nationally recognized thought leader on health disparities. And this is showing a recent editorial that she wrote to introduce a special issue of the American Journal of Public Health on a unified research approach to minority health and health disparities. I recently have done a bunch of work on treat all. Speaking of Dr. Burrell, here she is. We recently published an entire special issue of a journal on rolling out implementation to treat all people with HIV in sub-Saharan Africa, which recently became a global policy. It used to be very restricted. Treatment was restricted to the sickest people with HIV, and it's since been expanded more globally. And that opened up a very large research agenda and implementation agenda that we have been focused on trying to contribute to. We have Dr. Kelvin and Dr. Shung Lee and Levi Waldron, who are working in various areas of public health and epidemiology and reproductive health in modeling and cancer genomics, respectively. Okay, here we go. Infectious diseases, systems thinking and infectious disease modeling, cancer metagenomics and the microbiome. Levi is doing a lot of data science work, also another very hot field. Now I know how to get the answers to these things. Dr. Kasia Waika is doing psychometrics and working on the World Trade Center registry that has been put in place after the 9/11 attacks. Dr. Renee Goodwin is working on tobacco and marijuana exposure and policies. Shiro Horiuchi is a demographer by training, and he's been very focused on understanding life expectancy in Japan. And Dr. Heidi Jones focuses on reproductive health. And yes, there are many additional opportunities in addition to the one that I highlighted for you about the Implementation in Science and Population Health Institute, several different centers and certificate programs that you can take advantage of as an epidemiology student and as a student in many of the other departments. Thank you.
Okay, Dr. Cohen, please tell us about health policy and management.
Thank you, and thanks for coming. And it's really exciting to see you interested in public health. It's a field I love. It's not a field I was trained in college. I have degrees in urban planning, which is a distant cousin of public health, because urban planners think about the space of a city and the infrastructure of a city and how that can contribute to population well-being. I'm going to talk about the department that I'm in, Health Policy and Management, and we offer 2 degrees, as you saw before, an MPH in Health Policy and Management, and we also have a Master's of Science in Global and Migrant Health Policy. Health issues are global in scope, and as you know, as the climate warms and populations move, diseases will move around the world in different ways, and we have to understand from a policy perspective how to manage global health transitions as climate changes. And that's just one area in which global health is so important. We, in health policy and management, typically view the world through a socio-ecological model, which means that health is influenced by the individual characteristics, your attitudes, behaviors, and beliefs, your family and peers and social networks, your personal relationships, the institutions that you interact with, CUNY, the hospitals in your neighborhood, the organizations that people belong to, broader community infrastructure, and public policy. You might have heard in the news that the federal government is changing the rules on SNAP, the food stamp program, so that individuals who aren't working will lose their benefits more quickly. And we've been studying the impact of immigration policy at the federal level on immigrant communities who are afraid of signing up for public benefits for fear of being getting in trouble, losing their benefits, losing their green card, being deported in the U.S. So our field tries to use policy to improve population health by reducing public health threats and also increasing access to medical care. I did not put this PowerPoint together. I did not pick this clip art, but obviously this is lead coming out of the tap. You all know about Flint, Michigan, and all of the policy decisions that went into switching the water supply from a safer supply to a less costly but more dangerous supply without putting chemicals in the water system that would prevent lead from leaching in from the pipes into the water supply. Those day-to-day questions that we have to grapple with, how are government decisions affecting public health? How does the economics of public health care affect who can afford insurance and who can't afford insurance, right? I'm sure you're all aware of the issue of, should we have Medicare for all? Should we have Medicare for all who want it? Should we repeal Obamacare? Those questions are questions that health policy economists grapple with to try to understand what are the costs of different forms of healthcare and how many people in the population will be able to afford healthcare under different scenarios. There's a management side to health policy and management, and that's understanding how organizations function, how do hospitals function, and how can we make them more efficient? How can we make sure that patients have advocates who can provide assistance so that they get the right care? Our graduates do a lot of things. So this is a really bad clipboard of people protesting. I teach a course in public health advocacy, teaching students how to lobby for legislation, how to interpret laws and regulations, and how to respond to those proposed laws and regulations, and how to interact with government and the private sector and nonprofit organizations. So our graduates can become leaders in systems approaches to addressing public health problems. And our department is writing focused. And so if you're in health policy management, you'll have to and be able to learn how to write policy briefs, policy analyses, how to influence people through the writing that you do, and engage in political advocacy. So we teach, and as you know, public health is interdisciplinary. So we teach everything from healthcare systems and how they're organized and how they're financed, to how policy works, how laws get made, how regulations get developed. We also teach leadership skills. How do you actually work in an organization and become a leader to direct the organization most effectively? I teach advocacy techniques. We also use other methods like survey development, economic analyses. We have a lawyer in our faculty who teaches legal research methods. And so in public health, you'll be learning statistics, but you'll also be learning these other methodologies to use and apply. What would you do when you graduate? Well, you could work for a nonprofit organization, you could work for an advocacy organization, you could work in a hospital. Many of our students work in the healthcare industry. You can work as a program director in an agency like the Department of Health. You can do things like develop new programs, you can evaluate programs, and you can work in the private sector as well. Most large corporations and pharmaceutical industry have people who are in public affairs and public administration who interact with government all the time. You won't be destitute if you do this degree. I don't know where these statistics came, Bureau of Labor Statistics, but there are jobs for graduates in health policy and management. And these are headshots of our faculty, and it's a growing department, so we have some more faculty who aren't on here. And our research interests range from gerontology and healthy aging to HIV prevention and treatment, domestic violence as a public health issue, environmental health issues and the legal issues around environmental health problems. My field of interest is food policy, and I have a big research study on urban agriculture now that is looking at the food, energy, and water nexus or interaction of urban agriculture projects in the US and other countries in Europe to try to understand if we want to scale up urban agriculture, what would the health and environmental impacts be of doing so. We also work on issues of health equity, neighborhoods that have insufficient access to healthy food, and what can policy do to increase access and improve healthy food access in poor neighborhoods that will hopefully deal with the non-communicable diseases. Coronavirus is a communicable disease, but we focus in the work that we do in food policy on non-communicative diseases like diabetes and overweight and obesity and cardiovascular diseases that result from that. I don't know where this publication came from, because this is a book review, not a journal article. But we're published in a wide range of academic journals. I just contributed with my colleague Nick Freudenberg to a special issue of the American Journal of Public Health on the SNAP program. And Nick Freudenberg is interested in and wrote about college students who are food insecure, particularly at public colleges like CUNY, and how SNAP can be an effective way to provide more income to low-income students, and what are the barriers to students getting SNAP. I wrote about SNAP at the neighborhood scale, how you analyze the populations of eligible but not enrolled in SNAP people in different neighborhoods, and how we can understand why certain neighborhoods have large numbers of people going without SNAP when they are eligible. So I was talking about the work of the Urban Food Policy Institute. We also have a Center for Immigrant, Refugee, and Global Health, which works on projects literally around the world to increase access to healthcare in mostly low-income countries. Professor Terry Wong, who's going to be here in a moment, runs the Center for Systems and Community Design, looking at really interesting issues of co-design. How do you design solutions to public health problems with communities and implement them, and then evaluate them adequately? He has an interesting research project looking at the renovation of parks around public housing developments throughout New York City, and how the renovation affects physical activity among people who live in public housing near those parks, and is comparing the renovated parks with the unrenovated parks and looking at how much physical activity renovation stimulates. We have a relationship with NYU, the Prevention Research Center, which Terry also runs, and we publish books. Show of hands, which is the most interesting title here of all the books? Okay. No, I'm joking. This is a book I wrote a couple of years ago called Beyond the Pale about urban agriculture and social justice activism, but all of our faculty are really involved with exciting research projects, and I think I'm going to end there and turn it over to Spring.
Hi, so I know you can see that we all do a lot of amazing, diverse work, and so I'm going to try to help you see what's a little bit different about community health and social sciences. So our department applies a social justice framework to conducting research and taking action to improve community health. And I think you might say, okay, that sounds like what everybody's doing, and I agree. And one of the things that is really cool about public health is that we are all doing very integrative work, and we're all doing interdisciplinary stuff, and we are all really working together as well. So something in community health that you're going to get is a little more, I think, kind of working with the community. So actually going out into the community, not only kind of addressing the needs and kind of putting some of that into action, evaluating it, and getting feedback from the people that you're working with as well. So thinking about all these things that you're hearing, but if you really feel like you want to be with people, community health is the way to go. And I've been told by my department to tell you all that we're the best department. So that's not just me saying that, my whole department made me say that. And one of the Masters of Science that we offer through our department is the Health Communication for Social Change program, which is brand new. I'm super excited about that, and I'm one of the faculty in that program as well. And the Health Communication for Social Change is all online. So if you're looking for something that you want to be doing online courses, go for that. And the Health Communication for Social Change has how you can actually communicate this information. So you're designing messages and you're actually delivering, disseminating them as well, and learning how to evaluate those messages that are going out, and thinking about not only one-way delivery, but this interactive messages that we're using all the time now. So in community health and social sciences, we really want you to think about urban communities. So we are specifically thinking like New York City, and we are the leaders, I think, in urban communities. So when you're thinking about you want to make a real change where you live, where you're from, these communities that you've been a part of, at least now, maybe for most of your life, that is one of the strengths of our specific program at CUNY School of Public Health. The Health Communication Program, like I said a little bit, it has this real push for really getting messages out and looking at how to do that. So we're having a lot of skills taught in this course that are really about how to do that. And I think that one of the ways that this master's program differs than some of the others is it really is based in skills and learning those skills. And so, for example, one of the classes I'm teaching in this program is designing media and all sorts of media. So we do podcasts, we do film, we do infographics, we do social media, and like how are you doing all these things and giving you some real skills and being able to disseminate information across all these different channels. And then we give you a brief overview of each of our faculty. Again, like Nevin said, I didn't put this together, so I didn't make myself first, but I'm first on here, great. And so in the slideshow, we just go through each of the faculty members with some of their interests. And this information is all on the website too. And so I would just really encourage you when you're looking through the different programs to not only kind of look at the courses that each of the departments offer, but also the faculty members and what their research interests are, so you can really start to understand, you know, what it might be like to be in one of our specific departments. So we have all of our amazing faculty members here, and I'm gonna just move on and hand it right over.
Hi, everyone. My name is Brian Pavlonis, and I am in the Department of Environmental Occupational Health Sciences, and I direct our industrial hygiene program here at the CUNY School of Public Health. Okay, so within our department's big. So our department includes nutrition, which Gada will talk about, and environmental and occupational health sciences. And then we also have GIS in there as well. So for our environmental track within the department, we have two different programs. We have an MS degree and we have an MPH degree. You know, the courses are similar between the two degrees. You know, the big difference is the MS degree is really training you to become what's called an industrial hygienist. So an industrial hygienist goes out and measures and controls exposures in the workplace. So right now, me and a doctoral student are working on a study looking at nail salon workers' exposure. So nail salon workers are exposed to a lot of different chemicals. So what are their exposures? And then more importantly, how do we control those exposures? So how do we mitigate the hazard? And the MPH degree, you know, it's similar, but it's a little bit more, I think, broader and focused more on public health core courses, while the MS degree, I think, is very specific for industrial hygiene. And then the MS degree, I think some things that cut off, is 39 credit hours, and then the MPH degree is 42 credit hours. So a little bit difference in between the credit hours. Okay, so the nice thing, the MS degree, if you're accepted, you could get your tuition fully covered. So our MS degree is funded through a training grant through NIOSH, which is one of the centers for the CDC, and we offer tuition reimbursement for people in that program. The MPH degree doesn't really come with any sort of student funding, but the MS degree does. And we actually have one student right now. I'm not sure when he graduated from Macaulay, but he did come from Macaulay, and he's in the MS program, and hopefully I think he'll graduate next year. And he's an industrial hygienist. Okay, so like a lot of people talked about, you know, our students that graduate our program are working pretty much in the same places. I think the difference is everyone's talking about the coronavirus today. We're training students to protect the workers. So protecting the healthcare workers from exposure, and that can include personal protective equipment. So understanding what PPE is appropriate for that hazard, the ventilation system. So right now I'm teaching a course in designing ventilation systems. And if you think about it, you spend 90% of your time indoors, but do you know how the ventilation system works? Do you know how to use that to control exposures? So that's the course that I'm teaching right now. So a lot of our students work in healthcare and university settings, you know, making sure that, you know, faculty at the university, students at the university are not exposed to any sort of chemical hazard, hospitals as well. And a lot of our students also work for the federal government. So one student graduated and works for OSHA. There's a lot of federal jobs within New York City, OSHA, EPA. Those are where our graduates end up afterwards. And then the state health department, New York City Health Department. Okay, so what's the mission of the environmental occupational side of the department? Well, it's how to anticipate, recognize, evaluate, and control hazards. So what does that mean? So if we look at the anticipation and recognition portion of this, how are you exposed to chemicals in the environment of the workplace? At what levels would cause a disease or an illness? So that goes in anticipation and recognition. So toxicology. So we, of course, work in toxicology. How will that chemical agent affect your body? We actually have one course, it's all experiential learning. So students go out to 6 places throughout New York City and look at the workplace setting. So they go to hospitals and talk to the health and safety officer at the hospital. We went to University Hospital out in Newark a few years ago, and we looked at how, if they were an Ebola center, so if there were an Ebola patient, they'd be sent there. So we talked to their health and safety officer and how they would do quarantine. So that class is all devoted to actually going out and touring different places. Evaluation and control, so evaluation is measuring the exposure. So your data is only as good as your measurements. So how do you actually go out and quantify your exposure to air pollution? How do you go out and quantify your exposure to noise pollution? And then finally, if you know that person's exposed at a hazardous level, how do you then control it? So either through engineering controls or things like PPE or substitution. Okay, so we talked about this, really understanding what the chemical hazards are, how to go out and measure it, and then finally, the big portion, the public health portion, how to then communicate that risk. So within this discipline, you're going to be speaking to a wide audience. You're going to be speaking to, a CEO or policymakers, and then you're also going to be talking to workers that may not have that technical background. So how do you communicate your message to each one of those audience members? Okay, and obviously everyone asks after you graduate, what would be the compensation for this? There is, if you go on Indeed and you search environmental health professional, industrial hygienist, there's a lot of jobs out there available, especially a lot of jobs in New York City. Because I kind of run the fall program and I can track this because of our training grant, all our students that leave the program have a job, okay? The compensation for the job is going to depend on your certification and tenure, but it's anywhere between $80,000 to $120,000 with enough experience. So within 5 years, you should be making around $100,000. So it's a somewhat lucrative job within public health that uses a lot of your science skills from undergrad. Okay, and then God is going to talk about the nutritional portion of our department.
Well, thank you all for coming today. And this will be the shortest presentation because you have heard from everyone else, and we really collaborate in interdisciplinary programs. So we collaborate with all the programs that you heard about. So everything you heard applies to nutrition. I'm going to talk specifically about the MPH in public health nutrition. My background, I am a medical doctor by education, and I have a PhD in nutritional sciences, and I'm a registered dietitian. I got dietetic internship and nutrition internship. So I do care about everything as related to nutrition and food science. So what's public health nutrition? Well, you heard that the concept of food and the food policy, and Dr. Nevin Cohen explained to you part of the food policy and the food aspects of it. And then you get, in addition to the food, where you get it from outside to inside the body, the nutrition is really what's happened in our body, what's happened in this black box in our body. So you learn to know a lot of nutrition education that is based on evidence-based, that's based on facts. So as you heard from Dr. Joshi, that 25% of the population read in the internet their health information.
Well, you need to know where to get to credible resources to understand the nutrition education. For example, the dietary reference intake that people look at it, well, it is meant for specifically for healthy people. You read the definition, it says healthy people. Where 70% of the population have chronic diseases. You have someone with diabetes, you have someone with obesity, you have someone with heart disease, renal disease, chronic inflammatory bowel disease. There's a lot of diseases that if you take it out of the internet, it is not right. It's not meant to be that way. And this is what you learn in nutrition. What is healthy individual, how you deal with other chronic diseases, and what is the recommendation. You cannot, for example, tell someone with diabetes, eat fruits and vegetables. Well, fruits is carbohydrates, it's sugar, it counts in their intake. So you need to learn that when you do that in nutrition, in public health nutrition. And also, yes, we eat to survive, but really, there are several reasons why we eat, and we need to dig deeper into why people choose the choices that they have, and we work with the behavioral aspect of it, because you want to know the motivation behind why people do the things you do. And so we learn more about the behavioral structures and behavioral changes in our food content. Of course, you cannot, for example, go to a population, the people who do not eat pork, and you tell them this is how you make the recipe, or people who do not eat fish, and you tell them, fish, 3 omega-3 fatty acids, or you get to people who are purely vegan, and you insist that you want to have animal protein because it is good, it's good for iron. So you need to really be culturally competent, and this is what you learn in nutrition, the cultural competencies, as well as whether it is religion, whether it is by social norms, or whether it is personal preferences. You get to decipher that, and if you want to, for example, to take the SNAP budget and use it for different people according to their preferences, you learn that in public health nutrition. Nutritionists, by training, they build coalitions. As I said, we work with all different disciplines, and you are embedded in the community, because this is how you influence the nutrition in your community. And we also monitor data and look at the health statistics and health outcomes. You get also to be part of the dietary guidelines. Now, the healthy people are changing every 10 years, but the dietary guidelines are changing every 5 years. And if you are following the dietary guidelines 20 to 25, you know that right now you are in the midst of it. There is 4 sessions that have been utilized to look at the new dietary guidelines. You get to be part of that. You get to submit recommendations. You can submit concerns. So you are part of actually the dietary guidelines, and this happens every 5 years. So in the interim, right now, there is the 4th sessions where the committees and subcommittees are getting together, and you get to be part of that, and you get to participate. There is, there's systematic reviews about every aspect of food and nutrition, and this will be the recommendation. Now, also there will be recommendations for infants from the time they are born to 2 years. We didn't have that before. People have different concerns over the years, whether you look at cholesterol, total cholesterol, or dietary cholesterol. Although we don't have that fear from eating eggs, for example. So there are systematic reviews, and there will be new recommendations to the dietary guidelines. So you get to be part of that, and you get to disseminate this information and work with your community to decipher the information in that aspect. And then, as Dr. Nevin Cohen, we also advocate for policies, and they're the hub of food policy and the policies that address nutrition needs and nutrition concerns for our population. So having said that, this is overview. What do you do? So how are you going to do it? With our coursework that address the competencies that you need to learn. So the assessing the dietary nutrition status of the population of people. You also get to interpret the social and behavioral, environmental, political aspects and the cultural aspects of food. You get to also learn how to develop programs, to design programs, and then at the other flip of the coin, how to evaluate the nutrition intervention that you are part of it and how to make it more equitable. Finally, you get to analyze information and you utilize all the quantitative and qualitative skills that you collect as you are going through the MPH program to be able to analyze the information. And finally, at the end of the day, you really need to communicate all what you've learned. So you need to communicate it in a literacy-specific manner, literacy-appropriate and culturally appropriate manner, and you learn that in public health nutrition. So the coursework, we have 42 credits. The coursework, as you've seen, we have the core courses that everyone takes across the board. And then you get to take 5 concentrations of nutrition courses. One of them is the community nutrition education, which have the community aspects, and the nutrition facts aspects of it. Then you get to take nutrient metabolism, which is, again, as I said, our body is the black box. You want to know how do you absorb carbohydrates and fat and protein and vitamins and minerals. And you don't get calories from vitamins and minerals, but yet they are important for metabolism. So you learn then in the nutrient metabolism. Then you get to know nutrition across the lifespan, through the life cycle. What are people eating? What you need? Everyone eats according to the appropriate stage in the life cycle, and also utilizing the life course perspective and how it affects the food and the diets that we eat. Then you also get to take nutritional epidemiology. So you learn more from the basic, from the epidemiological studies and the epidemiology study design as well. And then you wrap it up with the food policy, and we have the course in the food policy to cover both the food aspect and the nutrition aspect. So these are the 5 core courses in nutrition. Then you get to take 2 of the electives. So that's why you have heard all these programs in our school, and you are welcome to mix and match to what best fits your career trajectory and your interests. So the core, of course, the School of Public Health is our faculty. So we are privileged to be working with everyone. But the nutrition core is, Dr. Ann Galba, she runs the dietetic internship program. I didn't talk about the dietetic internship program today, but we have a dietetic internship in addition to the MPH program. And I work both in community nutrition and in laboratory-based nutrition, and I do work at the Advanced Science Research Center. I'm specifically interested in a pathway that's within the insulin signaling pathway and how it affects the metabolism and how it affects survival. And then, of course, also Professor Karen Flores, and she works with community nutrition as well. And then Dr. Nevin Cohen told you already about the Food Policy Institute. He's the scientific director of the Food Policy Institute, and Dr. Nevin and Dr. Flodenberg as well. Our department chair is our Mary Schooling, and her interest is in epidemiology, so you get to learn a lot of epidemiological methods, and specifically Mendelian randomization, as well as nutritional epidemiology and environmental epidemiology. So your career opportunities, you can work in different places in the health department, whether basically it's the local health department or the state or the federal programs, broad in nutrition services and child care services as well. And general nutrition educators work both in the state and the federal level. And you can get to global health and international nutrition. And in fact, some of our students work in the WHO and the United Nations. And some of them just have a local, like the World Food, where they go, whenever there is a disaster in the United States, they go and provide the nutrition education and the nutrition support and the food service as well. Some of the public health nutritionists work in the healthcare industry, in hospitals, or in outpatient nutrition counseling, or freestanding clinics. You can also work in NGOs if you prefer, donor aid agencies like the United Nations or WHO, and then also provide population and personal nutrition services, in addition to the food industry as a whole and entrepreneurship. So that's the part of the presentation that I have, and again, I think there will be questions and answers. Thank you very much for your attention.
Okay, so you've heard from some staff members, you've heard from our faculty, but now it's time to hear from one of our students, Tamara McDonald. She is a current student in health policy and management She is also the treasurer of our Graduate Student Government Association that she'll tell you about in a minute. Come on up. Hi, Tamara.
Good evening, everybody. Hello. My name is Tamara McDonald. As mentioned, I'm in the Health Policy Management track, and I'm also in the Student Government as the treasurer for this year. So basically about the course, it was something that I have a little background about myself. I have an undergrad in public health, and it was a health promotion track. So my focus was on health promotion as an undergrad. And as I grew into different roles and fields in family planning, I've learned that I was more interested in the policy. So hence my degree in health policy management. And as I do work in a federally qualified health center now, and I deal with patients ages 12 to 24. And every course I've taken has related to my work and really just reinforced me finishing this degree and having the background and learning the ins and outs of public health through a master's level. Dealing with quality improvement, how you analyze and promote better access to quality care, all is related within the field that I study now. And for example, my current course in health economics talks a lot about CQI, which is continuous quality improvement plans. And this is what I do at work. So I was like, wow, it's coming back. My boss is not crazy for having me do all this work. It's relevant. And these small PDSAs, Plan, Do, Study, Acts, do work in the actual community center setting. And it's not just practical work. It's actually implemented in community health centers in New York State, especially. The courses I've taken have definitely given me some actual experiential work. I've taken Dr. Cohen's course in advocacy, and we were able to go out and actually advocate on behalf of current laws and bills that were current in New York State. And it was a great experience to have that back end, because I've lobbied before, but not in the sense of knowing how this paper got into my hand. I just was able to meet with the legislators and in Albany, but then the course really taught me how the back end works, the meetings, how you prep for those lobby moments in a bill that you want to become a law. And I think that if you're interested in that policy level, that's a track for you. And definitely advocacy work, being a public health advocate, is what that field is mainly about. And I'm open for questions.
Hey, we'll have some Q&As. I'd like to invite Dr. Burrell to sit on our panel. Tamara, you as well? And then I know that we have some listeners on our Facebook Live feed, and I think there are already some questions. Yeah, I think it's a two-part question, if you could ask it. Oh, here are the mics.
Oh, really?
Yeah.
So to start, we have a question from Anna Somo. So it's 3 questions in one. All right, so how would an MPH help someone who is interested in becoming an allied health OT professional? What overlap is there between working in public health and working as a clinician? And is it possible to take 15 credits in undergrad and defer for a year before continuing the graduate degree? So just a whole bunch of questions.
So yeah, let's answer that.
One at a time, yeah?
Those first 2 seem related. Can you repeat the first question, and maybe we'll have.
How would an MPH help someone who is interested in becoming an allied health OT professional? And then, as part of that, what overlap is there between working in public health and working as a clinician?
Do you want to answer it? Anyone else? Dr. Solomon? Dr. Burrell?
So I have a dental background. I started as a dentist, and switch to public health. I wish I had done it the other way around because maybe I probably would be in dentistry. One of the reasons why I didn't like dentistry is because it was helping one person at a time. I had the background in public health, I would have found different way to approach the patients. So I do think that having a background in public health can help with health early.
Thank you.
So public health helps with everything in clinical aspects. So, when you want to go to clinical practice, you are dealing one person at a time. And it's much easier if you start looking at the big picture first before you focus and zoom in on one person. So if you start with the public health foundation, knowing the basic, knowing how to look at the through the ecological and social model, how to look from an individual to society to organization to overall the country, and to see it from the overall perspective and how each policies can affect in general. And if you go to be a clinician, how you're going to deal with healthcare, and you're going to deal with insurance policies, and you're going to deal with people with economical issues for the people that you are treating and dealing with. If you started with the bigger pictures and knowing that there are policies and knowing that there are ways to go to and knowing that there are programs that you can refer to your patients to and talk to them about what will be important to them as an individual with your overview to that, it will be helpful towards your next stage and your next trajectory if you want to zoom in on one individual at a time.
Thank you.
Add to that, coming as a clinician myself, I think the biggest challenge was that the patients might come back again and again for the same reason. Okay, and the only thing what you do sometimes is write a prescription. And I think what public health adds is a social determinants of health lens, which means that healthcare delivery cannot be just viewed from in siloed approach, but it has to be looked from a very broader perspective. For example, it's a very simple example, I'll give it to you, especially when you are talking about the context of an OT or a allied health or anything like that. If a patient is coming to you, we always tell them you should be physically active, take less salt, and eat more fruit and vegetables. That's a common guideline. But as a public health, if you're taking as a nutrition specific, you could actually quantify and personalize based on your understanding about how to approach the same condition. I think that's a very big plus. Most of the clinicians are not trained as a nutritionist, for example. But if you are a public health nutrition with a clinical background, I think you are doing much more bigger role than just being a clinical person.
Thank you. So the final part of this question.
The third part.
Oh, yeah. Yeah.
The third part of the question, just to repeat it, would it be possible to do the 15 credits while you're still an undergraduate and then defer for a year before coming back to finish the master's degree? The answer is yes, that's possible. It would be acceptable. I don't know that we would encourage it too strongly because people tend to lose some of their focus and some of their expertise, but every case is individual, and there is nothing in our memorandum that would prohibit that approach.
I'll resonate with, I think that's perfectly, yeah.
Anna says thank you as well.
Great.
Hi, my name is Devjani. I have a quick question about the 15 credits. You said that it could be applied to your undergraduate degree as well. Is the 15 credits applied specifically towards your major or just in general towards your degree?
So I think I better take that one, Johnny. Thank you for the question. The 15 credits that you take on e-permit while you're an undergraduate, it's acceptable for them to count towards your undergraduate degree, but we can't make a guarantee whether they'll count for your major or not. That depends on your specific major, and your major department would have to determine that. We're working on it, and by the time you are actually registered in the program, we're going to have a set of worksheets, I guess, with possible equivalencies that you could take to your home department and say, I'm taking this course, this graduate course at the School of Public Health. Maybe this could count as this requirement for my degree, but we can't make that decision. Your department would have to make that decision. But we do want to give you guidance in what kinds of things they could count as. They may just be general electives, but we're going to try wherever possible to find an equivalency.
Thank you.
I just have another question. What if you're at that point where you're exceeding the 120 credits to graduate? What happens then?
That's okay. That's the easy answer. A lot of Macaulay students graduate with more than 120 credits, and we're figuring this as an 8-semester, Macaulay as an 8-semester degree program. If you're going to graduate early, then that, I assume that would be okay too, but we would have to work that out on an individual basis.
I think the program has been tailored in such a way to make sure we've taken a lot of scenarios into account of what possible situations can happen. But, life is there, there might be some, as we go along, we'll be learning ourselves. But I think if you're going to take more than 120, it doesn't make too much of a big difference because just adding up.
Hi, thank you. So in terms of tuition, I know that's a huge concern for all of us. Would the 15 credits count towards the Macaulay tuition and be covered, or would it be, like if in the case of it's exceeding 120 credits or not applying to our major, would we pay out of pocket?
This is something we've been working on very, for a long time with CUNY Central to try to get a straight answer, and I think that as of today, we have the answer correct. And this is our understanding as of today, and I do believe it's accurate. The CUNY rule is that if you take courses on e-permit, graduate courses on e-permit as an undergraduate, then if those courses count toward your undergraduate degree, they're covered by your full-time undergraduate tuition. If they don't count toward your undergraduate degree, then you would have to pay for them, but there's a cap on the total amount that you can be asked to pay to CUNY, and that cap is your full-time undergraduate tuition. So, as Macaulay students, if you're in-state and have the Macaulay tuition waiver, the courses you take while an undergraduate would be covered by your Macaulay tuition waiver, except, and this is the exception, summer courses, right? Because Macaulay covers summer courses only at the undergraduate rate. So the summer courses that you would have to take for this program, you would have to pay the difference between the undergraduate tuition and the graduate tuition. So you wouldn't be paying full price, but you would have to pay that difference. And that would be charged by your home campus. Yeah. And then once you graduate, of course, from Macaulay, then you're graduated. We don't cover anything. Yeah.
The only thing is, like, once you graduate, then you are paying actually the graduate tuition rate for the programs.
Well, you may apply for
financial, of course. Yeah.
So my question is about the online classes. So is it that all of the classes are offered as online and you can only take 15 credits online and you have to take the rest in person? Or is it that there are some that you have to take in person?
The answer is that there is a wide variety of options. The goal was that we wanted to have an advanced certificate in public health where all the core courses, all the 5 core courses are offered as online. But there are many programs, for example, in epidemiology, community health, or public health nutrition, which do offer certain courses as online sections. So there is an option that if you are not intending to take a course which is face-to-face, you have the option to pick an online course. But I'll let...
Sure. Even for the 5 core courses, my department is responsible for 2 of those courses. We offer session online and in person. So they are the choice. When it comes to the core courses, we are moving into having online and in person, but right now we have online and hybrid, meaning that you meet sometime in the classroom, sometime online.
Taking hybrid courses, and it's like
in, 8 weeks out online, and I've taken some of the core courses, was it Public 614 online solely, and it was great. It was easy. You have a community with your classmates and the professors and the TAs there, so it's all.
I would just like to add that the core courses, so right, the ones that I highlighted, are offered online or in person, except in the summer. In the summer, they're only offered online. In general, 15 of the 42 credits are offered online. In general, the rest you have to come here physically for, but like we said, it depends on the program and what courses.
For example, like the MS in Population Health Informatics, which I'm teaching. So these are concentration courses, but they are taught like live and synchronous. Like literally you can be anywhere in the place. And if in any case you miss your lecture, the recordings are there for you to go back and look at it. So that gives you some kind of an option based on how you want to take the courses actually.
For the courses in person, we do record the lecture, and we sometimes allow a student to join the Blackboard Collaborate.
Just to add one thing that I forgot to say before, we're really committed to having students in this program succeed. So when you're an undergraduate taking these graduate courses, we're not planning to just drop you in there, sink or swim. We expect to have full support both here and at Macaulay. And we'll work with your advisors on your campuses too. We don't want anyone to feel like they're struggling or drowning in these courses. We want to help you do well.
I would say that more than 100%. I think we are here to support. I think everyone who's here is committed to ensure that the student success is the priority.
Thank you. I had one more question about the courses. I noticed that on some of the sheets there are like timelines for the different courses being offered. If it says that it's offered like year 4 spring, is there any flexibility to take it in the fall, or is it the specific program only offers these 3 core classes over the spring? Because I was thinking in terms of my schedule, some semesters might be heavier in terms of undergrad courses. Hi, I have a question about the personal statement. Is there like a maximum amount of words that, because some personal statement, they cap it.
I'm very sad with numbers. I tried to write it down. 600 words maximum.
Okay, and what the focus of your personal statement, should it be towards the program you're interested in or just in general?
Explaining your personal and academic rationale for joining the program, meaning the 4+1 program, your commitment to pursuing a master's degree in public health, the health sciences or industrial hygiene, and or your desire for a career in the field of health, based on your current program of study or work experience. We don't expect you to be an expert in these programs when you have even started the field. So you can refer to a program that you think you're interested in. That would be terrific. But we're not going to say, well, you know, you said nutrition, that's it, you're stuck with nutrition. Although who would not want to?
And
yeah, nutrition is good. They're all good.
And also, like, you know, you're taking some of the courses. This is just also for you to explore your interests, not to just be so selective and so pre-selective in terms of this is where you want to go.
Add to that students once in the programs, at least within the MPH, with department permission, can switch to a program other than the one they maybe applied for initially, but they have to be admitted through that department. So that's not a given, but sometimes that does happen. And I assume it. Absolutely. From the core courses, you get exposed to the full range of public health and maybe become a little more focused than when you applied.
Natasha Perez asks, what does it take to address cultural factors driving health outcomes? Recognizing it exists is one. What does it take to address cultural factors driving health outcomes? And one of them would be recognizing that there is a cultural factor in the first place. I think she asked it almost immediately after we had the very first question that you had answered, Dr. Joshi.
So yeah, I can highlight on my research area. In informatics, we specifically use a term human-centered design. Okay, human-centered design specifically looks at not just the social, but the economical, as well as the cultural and the contextually relevant perspective. To answer the question, first of all, you need a public health education. Okay, and that's one of the pluses of it. No matter what program you go into, and secondly, I think each program or specialization offers a specific lens to approach this. From an informatics perspective, and then I will pass on to Professor Borrell about that, is going to be that we specifically, human-centered means what does the user want, what are the tasks they need to perform, and how do you create solutions which are very user-centric, which takes into account cultural and contextual relevance as a very key component of human-centered design.
From the epidemiological point of view, the idea here is that we need to look at different layers where people live, interact, and basically relate to each other. The assumption is that every individual have an independent outcome from the next. But if we live in the same neighborhood, we share something. So that needs to be taken into account. And it's not only about lifestyle, but it's also about the culture of the place that sometimes have an impact in our health.
So I'll add from the nutrition perspective, definitely it's incorporated in every aspect of the public health nutrition curriculum because the cultural aspects affect what we eat. So we study different regions of the world, whether they're eating in where they are located, and it's partially cultural, but partially the availability of crops or certain water or certain fish that their location that they are. And then we talk about when they immigrate and what is the differences between what they keep as culture and what they needed when they were in their own country and coming back as immigrants. And then the aspect of there's also different degree of acculturation. People have different ways where they incorporate their own heritage in their food they eat, and then according to the level of the acculturation that they are willing to do or can do, there is differences. So we talk about those aspects along the nutrition perspective.
Awesome, thank you.
Hi, my name is Mia Chen. Thank you all so much for this panel. It was like really illuminating and really beautiful. I'm currently working on a thesis that analyzes the public health implications of current U.S. immigration policy, and I was wondering, as an undergraduate student, if there's any like faculty or students or researchers that you know who would be open to talking about anything along those lines. And like, I guess I could broaden the question so it applies to all of us as undergraduates. Would we be able to like, is it like a really open space where we'd be able to like collaborate on things like this?
We usually get called from Barnard College, from other places to be a second reader or a thesis. So definitely, faculty here are open to that.
Do any of you know any faculty members or researchers that are specifically working with like the Latinx community, immigration?
Depend what is your focus. I do a lot of work in acculturation and in the Hispanic community. Specifically, I'm interested in the Hispanic heterogeneity. People lump us all together thinking that because we dance merengue and speak Spanish, we are all the same, but we are very different. So I'm very interested in that.
Please remember that we have a Center for Immigrant and Global Health. So that having a center of that nature highlights the importance of this issue within the school.
How does is there in this program any way to facilitate or go go to communities with language barriers? Like, how does this program facilitate that? Are there classes that go out in the field in New York City or maybe other places where there is specific language barriers, for example, in Jackson Heights? Oh, sorry.
If I'm understanding correctly, like obviously, like almost all the programs have an experiential learning component, for example, and there's a capstone which is involving to deal with the communities across the city of New York, but also globally. That is one. Secondly, if I'm also understanding it correctly, we are a very diverse school, and that's a strength for the school, which means people are coming from all aspects. And I think that diversity in terms of its language, in terms of its ethnicity and everything, is a big plus to be in the School of Public Health. That's the second component. And the third, I would also say that, especially in the jazz, I know that we don't have it right now, but there are faculty, and as Professor Borrell mentioned, like we are actually establishing a collaboration with University of Alcala, which I would like her to highlight, which will tell you of how we are approaching this as a way to reach out to those populations where English might not be the first language.
Right now, we are developing a memorandum of understanding with the University of Alcala. And the idea is to establish a MPH fully online, in which a student will literally, we were told that it was okay to do Spanglish. So the focus is in English, but there is going to be some hand-holding for some students that have some comprehension issues. So we definitely working on that approach.
So if we want to go further, like globally, should we, before coming to this or during our stay in the program, try to acquire a language outside of CUNY per se? Or, I mean, there are still CUNY courses with language, but.
So that's something that can be facilitated. We have some students that have done internship outside with, we have actually some engagement with City College, the School of Medicine, in which they have a program that is focusing cancer research, and they are sending a student to Tanzania, Spain, and they are actually facilitating that sort of internship.
First of all, this is a great collaboration for the School of Medicine. Dr. Ahmad Suleiman is the lead PI on that. And the amazing aspect of that, it's a fully paid scholarship. So it's about $7,000 approximately. Don't exactly quote me. It could be like 7,000 plus or $500 less or more. And I know like Kada can speak more on that. But we have had a huge success last year because it was a new thing. 3 students went, and this year I am not sure about the outcome of the applications right now, but we had from CUNY School of Public Health about 9 applications to the program. So that tells you that there is opportunity not just to travel, but there is also an opportunity which includes paid coverage for those things. And obviously, because our programs are more and more becoming online, we have an Office of Exponential Learning. Susanna Lynch, she couldn't be here today, but the mandate of that office is to establish formidable sites which expand not just within New York City, but beyond New York City. and also look for scholarship funding and other funding opportunities for students to go abroad.
So the name of the program is CESP, or Cancer Epidemiology Education Special Population. And we recruit students from all universities and all aspects. And there is a certain application that you can look at it online. Actually, the application deadline just was in this in January, where you contact the program director who will help you define the project. And if you want to go internationally, you can go to any location. There is a set of infrastructure in Africa, in South America, in India. There are several places according to your areas of interest. And you work with Dr. Amr Solomon to develop the program and the project in consultation with your advisor and consultation with the preceptor, who connects you to preceptors in different aspects in different countries. And there is a review process. It's a peer review process. So you get to present and have an interview and tell them what you want to do and how it would work out. You get also evaluation and help to define the project. And then you go in the summer, and the program director goes with you to where you are or visit you and set that infrastructure. It's an 8-week in the summer in different countries, and you get to do the project. At the end, when you come back, you present what you have done, and you get also help with generally with career, whether you're going to do, what's your next step, whether you're going to do with this project, how are you going to apply it when you graduate. So that you can look online as well.
Thank you so much.
Other questions occur to you, you can always email. Happy to answer questions.
Your agenda obviously has all the speakers that were here today. You can easily find them on our website if you have specific questions to them. You can also email me. You can email admissions@sph.cuny.edu. Super simple, okay? Thank you so much for coming. There's some more food in the back.